I'm Dr. Raina from Affinity Smiles located in Skokie, Illinois. I get a lot of questions every day about what exactly are clear aligners. Clear aligners are trays that go over your teeth. Right now, they're custom made to your mouth, and then they help us move from point A to point Z. So, point A is where your teeth are right now, point Z is where we're trying to go to get you a happier, healthier, more aesthetic smile. And commonly, some people know clear aligners by brand name that are out there, but realistically, they're all clear aligners. What are clear aligners and how do they compare to braces? So, clear aligners and braces are kind of two ways to get to the same destination. And sometimes one way will get you there faster, more efficiently, more predictably. So, braces are typically what you're used to seeing as like metal brackets. Sometimes now they're clear brackets, brackets meaning like buttons that are attached to your teeth, and they help you move your teeth from point A to point Z, and you can't take them off your teeth. They're kind of with you, and they're a great option for patients who are worried about compliance, or maybe for the pediatric population where you don't know if they're going to be able to wear the trays all the time. And that brings me to the point, like, clear aligners are something that are achieving relatively the same results, but they're very, very dependent on the patient compliance because they need to be worn about 22 hours a day. What's faster, clear aligner or braces? That really comes down to the patient's customized treatment plan, because sometimes one, like, even though both can get you to the same destination, one will be faster than the other. And then that's something that you and I would decide once we got together and did a treatment plan and figured out what was the best fit for you time-wise and, of course, end result. How does the comfortability of, clear aligners compared to braces? So clear aligners tend to be more comfortable than braces because you can take them in and out. With braces, you tend to feel them along your lips, and that can take some time for people to settle. However, both can get pretty comfortable after you get used to it. The main point that I tell my patients to expect as they're going through orthodontic treatment, whether it's through clear aligners or braces, is as we're moving teeth, when we're initially making some of the bigger movements or really honing in on getting a tooth where it's supposed to go, it can create some soreness as the tooth is moving, but that's usually a good sign that we're actually getting the movement that we're trying to achieve through clear aligners or braces. When I have a patient interested in clear aligner therapy, I often get asked, like, so, okay, I've heard about it, I've read about it, what comes next? So in order to customize the treatment plan for my patients, we first start with a very thorough consult. During that consult, I'll grab the records that I need, because once the patient leaves, that's when my work begins. I use that time to digitally plan out everything that's going to go into that treatment. We also take that time to discuss, like, pros, cons, things to expect during the treatment, and really what is expected from the patient to make the treatment successful. After that, it's all on the doctor. So I will be taking all of the information, customizing your treatment plan. As soon as you're ready to invest and commit, we go ahead and get those trays custom made for you and begin our treatment. People are also very curious before starting, how long will this take? And how many trays are required. So the length of the time of treatment, as well as the number of trays that are taken, are really dependent on the patient and our goals and how long it's going to take us to get there. But to piggyback off of that, another question that quickly follows after is like, okay, well, how much will it cost? Is it, is it cost per tray? Is it cost? How does that work? So when we have a firm idea of like a treatment plan and exactly how all of this is going to play out at our practice, we have a very easy way of tiering the treatment as like mild, moderate, or complex, and that's how we price out our treatment. So it will really be dependent on that, because we don't want to interrupt the treatment to tell you, oh, hey, actually, it's going to be this much now, this much now. That's not a great experience, because this is something we can pretty much already anticipate when I'm virtually planning out your case. So we've talked a lot today about like why clear aligners are great. And there are some instances though where a patient may not qualify for clear aligner therapy. And usually those are actually very parallel to, you may not qualify for any orthodontic treatment. The reason for that being is we want to make sure that your gums and your teeth are healthy enough to move, because we don't want to move teeth that are not in a stable foundation. So the first thing, and this happens during that consultation phase at our office, whether you're already a patient of our practice or coming in as a new patient, we do a thorough evaluation of the foundation of your teeth and the health of the teeth themselves so that we can move them safely. Outside of that, there's certain movements that clear aligners cannot achieve. And in that case, we go the route of braces. And again, that's something we will discover together as we go through the consultation and figure out what your goals are and what the capability of the treatment is. Everyone always wants to know, am I going to be in pain when I'm going through clear aligners? It is a great question. So we will be visiting this in a lot of detail during the consultation, because before you sign up, I need you to know exactly how this is going to affect your lifestyle, right? Typically, as you're going through the treatment and you're switching into new trays that are getting you closer to your final position, you will experience mild to moderate soreness, which is usually controllable with Advil or Tylenol. And it actually decreases as you go through the treatment when the teeth are like starting to get flexible and moving as we want them to move. So, yes, there may be some mild discomfort, very manageable, very doable, and in the end, totally worth it when we end up with a healthy, happy, and functional smile. If you're curious about whether you're a candidate for clear aligners or orthodontic treatment, give us a call. Our phone number is 847-227-8192. We would be happy to see you, do a workup, and figure out if you're a candidate for clear aligners.